Hi, my name is Cheryl Moore. For this semester, Practicum 3, I'm going to be working with a 6-year-old child who has epilepsy, falls under the autism spectrum umbrella, has apraxia, which is a motor speech disorder, and severe learning delays. The child was born normal and at 6 months had gotten meningitis, which caused him to have epilepsy. I work with this child on a daily basis. At first, the child did have words and were speaking up to 50 words, and then over time lost all his vocabulary words. He's on a lot of different type of medications, and due to these medications, it will depend on how his day will go. Some days he'll be hyper and happy and laughing and smiling, and other days he will be lethargic. It would also go as depending on how his night went. He has 7 different parts of his brain that will cause him to have an episode of epilepsy. One of the factors as well that can cause it would also be heat. So in the summertime, he can't be outside in the heat if it's hotter than 80 degrees. Another thing too that could set off his seizures would be being tired, overtired, not allowing his brain to rest. His body is not able to perspire and sweat, so his brain tends to overheat. From time to time, you'll see him laying on cold linoleum floor trying to cool his body temperature down. He also loves the snow. It's nice and cold and it cools him down, as well as popsicles that cools him down. As far as his learning, some days are easy. Some days he will let me do hand over hand with him and write his name. Other days it's throwing his pencil, throwing things, or just kind of sitting there trying to hit you because he doesn't want to work. And slap you. He does have sensitivity to different things. For example, if his shirt gets wet, he will not wear it. He'll try to get it off. As well as his shoes. He doesn't like wearing his shoes. He has sensitivity to different type of foods and the texture that there is. If there's a certain food with a certain texture, he will not eat it. He does communicate to us through sign language. We have taught him how to do sign language, so he knows how to say want and please and sorry. His doctors have lowered some of his medications, the ones that they feel is keeping him from being verbal. So he is starting to say no again and yes, and also trying to sound out certain sounds. The beginning of fall, late August, or beginning of August, I would say, early fall, late summer. He did have surgery to where they had put this, it's kind of like a little mechanical machine in his armpit, like a pacemaker, and the wires are hooked up to his muscles that go to his brain. It can record anytime he has a seizure. Also, with that little machine, we have a little magnet that we can go over his chest with it. It's a very strong magnet. The magnet will start the machine to send shock waves to his brain to kickstart his brain to try to kick him out of having a seizure. I've only had to use it once with him, and it worked. Usually his seizures will last anywhere from 10 to 30 seconds. Anything more than a minute, 911 needs to be called immediately right away. This school year, he's only had to be taken to the hospital once for a massive seizure. Usually I can tell in the morning when he's had a seizure, he's wiped out. He's tired. The seizure takes all his energy from him. He has a hard time walking. He will be very wobbly, doesn't want to walk, wants to sit down, is tired, and just wants to sleep. Because as I said, the seizure will suck out all of his energy. As far as apraxia, there is a possibility that he might grow out of that. And then again, there's a possibility he might not. We're not quite sure on how far on the spectrum of autism he is. We do see a little bit of that in him. And as time goes on, his speech therapist and his physical therapists, along with the special ed teachers, also notice more and more autism in him. But as far as working with him, he's a great, loving child. He likes to hugs. He has his certain toys that he likes. And then there's, like I said, on his bad days, it will all depend on how his night was the night before, and also on if he had an episode or not. There's some days where it's really hard to work with him, and there's other days where it's just a fun blast. It's really hard when he can't walk. We do have a stroller to put him in because he is 50 pounds. So when he goes into an episode of a seizure, he will be dead body weight, and it will be kind of heavy for us to lift him up. So we have a special stroller that we can put him in, that if he's sitting in it, it will turn and lay, like, we can pull the handle and it makes him lay down, so we can work on him if needed to. Other than that, he is delayed in, fine motor. His large motor is perfectly fine. He can move around. He runs. He's a very, very strong child. And as far as like fine motor, cognitive, he's delayed in it. He would also be delayed in, in other areas that a normal 6-year-old would not be in. His mentality is of a 2-year-old. So, working with him, I have to remind myself that although he's 6, he's got the mentality of a 2-year-old. And he's not potty trained as well. So with that, we help him out with his potty training. But anyway, so that's a little bit about the child that I work with. And if you have any questions, just go ahead and ask. Thanks.